possibility is likely. The United States is advanced in the medical field compared to other nations, yet a Dallas healthcare worker who helped treat an Ebola patient who was diagnosed with the disease herself. If the caretaker can develop the disease in proper conditions, then when America sends aid to West Africa, where the medical conditions are very poor, then the chances of obtaining the disease is high. Therefore, American citizens are at severe risk. Combating a disease in another whole continent would only satisfy citizens' morals instead of the nation's practical approach to efficiency and safety of America. Contention 2. Additionally, there are extensive measures that must be carried out by the medical assistants, and it makes combating the disease much more difficult for the United States. The head of the CDC, Tom Frieden, vowed to double down on training for healthcare workers. Therefore, in order to properly treat patients in West Africa, American healthcare workers must go through extensive training, which makes it more difficult to send aid who are willing to sacrifice their time and medical practice. Dr. Gavin McGregor Skinner from Penn State University claimed that we haven't provided them with necessary experts who have actually worked in hospitals with Ebola. If Ebola patients in West Africa need expert medical assistance from America, then if or when the outbreak migrates to the United States, then citizens will not have expert help for themselves. Also, when preparing to treat Ebola, putting on the proper medical gear requires assistance, so there must be other doctors available to assist. Somebody must also watch the gear being removed step by step, so the disease does not have a chance of spreading. Medical aid could not meet standards if a team of doctors weren't sent as a unit. But if more expert doctors are sent, then the United States advanced medical field could potentially crumble and would destroy the safety of health for those who are ill. Contention 3. Not only does combating Ebola put the nation at severe risk, but it would also be highly costly for America. The medical gear needed to treat Ebola is, but not limited to, hazardous material type suit, a gown, 2 sets of gloves, a face mask, and eye shield. It may not appear much to the average American, but only large hospitals affiliated with major universities have enough equipment and manpower to treat Ebola properly. So it would be costly to provide all the proper equipment in West Africa. It costs $500,000 or more to treat one Ebola patient. Care costs $18,000 to $24,000 per day for treatment. There is also a cost to dispose of contaminated Ebola materials properly. Some Americans want to help combat Ebola, but who is going to pay? If West Africa can't afford to combat the disease themselves, then reparations will have to come from America. It would not be practical to spend so much on combating Ebola when the lives of American citizens would be at risk. I have shown you that with combating Ebola, risk-specific medical protocols and treatment costs are all involved. For these reasons, we can clearly conclude that the value of health and safety in Americans' lives should be upheld, and the United States should not be responsible for combating Ebola in West Africa. Clearly, we must negate the resolution.
Okay, with your numbers, it's 50,000 or something. Was that for each patient or just the cost overall per day?
It was the $18,000 to $24,000 was the cost per day for a patient, like for the hospital to bring in the materials they need and to take care of the patient themselves.
Okay. Whenever you talk about how the United States has such advanced healthcare and the people in West Africa don't have the availability to such, health care options, how do you expect the people in West Africa to deal with the disease and keep it from getting worse without American help?
But if the people in West Africa, if we aren't involved directly, then we won't bring the disease back to America, which is the main concern. Because like you said, 1 in 6 people are concerned they're going to die from Ebola. But if that number is so high compared to the population of our nation, then we want to lower those risks for them developing Ebola, and the risk would only get greater if we do help combat the disease.
But if no one goes in to West Africa to help combat the disease, and like you said, Africa doesn't have the necessities to combat the disease, then how are they going to keep the disease from spreading to other countries? Which, if it spreads to other countries, it could spread around the world. How would that stop from happening if we don't go in and help and try to prevent future outbreak?
Other leading nations that are actually over there with them could potentially go over and help, but also just because the United States as a whole government won't be responsible for combating the disease, individuals could potentially go over themselves, but America as a whole should not be responsible because it will only cause greater danger for our nation.
If individuals go over there themselves, they may not have the proper training like the U.S. military and soldiers are getting right now. So if they go over there as a private party to try to help control the disease and they don't know the precautions and they don't know the procedures, then wouldn't that be more dangerous than sending over soldiers that are trained and prepared?
The United States can't control, if you want to go over and you don't have any medical requirements whatsoever and you don't really know anything about it, you can go over at your own risk, but that's why the United States is saying we should not go over there and help, because those who go over and say they're going to help really aren't going to make much of an impact, and then the only way to stop that would be a travel ban, which if the United States won't be involved, then that's what it will ultimately lead to.
Okay. Oh, wait, it's my turn. Oh, I've shown you that through my 3 contentions. Contention 1, the high death rate in Africa, shows that we need to help combat the disease. And I gave you the numbers about how the thousands of people in Liberia and in Guinea and places like that are having high death tolls, that we need to go in and provide assistance so their numbers don't grow greater and potentially eliminate African population. And with my second contention, saying that soldiers that are going to Africa are properly trained and they know how they're going to combat the disease, and they know precautions and they know how to properly take care of themselves along with the patients, that sending them isn't going to harm them if they just go by protocol. And my third contention, saying that the Ebola outbreak has caused panic, which is evident. If you turn on the news, you're going to see something about Ebola. If you go outside and, go on a walk, then maybe you'll get Ebola, who knows? But the mass hysteria with Ebola is one major reason that the U.S. needs to combat it in West Africa, to create a security blanket kind of feeling for the Americans in the United States.
Okay. So you're saying that with Americans want to combat Ebola, because they're so concerned with developing the disease, correct?
Yeah.
Okay. But isn't the utmost value, or one of the goals of the president, is to keep America safe as a nation?
Sure.
And wouldn't it be much easier and more practical, and there'd be less spending, if we didn't get involved in the Ebola crisis and we maintained ourselves as a nation? Because as of right now, there were only 2 cases came back from West Africa. They were doctors. They were treated. But then the Liberian guy came back and he started spreading disease because there weren't the proper protocols in America. But if America says we cannot be involved, then that will completely put up that barrier, and there will be no case whatsoever for an American to obtain the disease. But the value of Ebola, combating disease, is the health for our nation. And by saying that we should not be involved just completely puts up a barrier, and that way Ebola can no longer travel to America whatsoever, because we're on a completely different continent. But America is not responsible for combating Ebola in West Africa. The value of health and safety in Americans' lives outweigh the consequences that result from the intervention in West Africa to the highest level. If America intervenes in combating Ebola in West Africa, it will lead to greater problems beyond our handling. Not only will it be costly to provide such aid and humanitarian assistance, but it will also put the lives of American caretakers and citizens in great danger. Additionally, there is great difficulty providing such advanced equipment to the area. It is known that Ebola has been carried back to the United States, and a caretaker became infected over treating the patient. However, if an American can obtain the disease while working in America's advanced medical conditions, then many American healthcare workers who travel to West Africa will have a higher risk of getting the disease since there are poor working conditions. When evaluating the importance and value of human life, it is evident that we must negate the resolution. Thomas Jefferson, one of America's founding fathers, justifies the dimensions of the choice. The care of human life and happiness, and not their destruction, is the first and only object of a good government.
With that quote from Thomas Jefferson, that could also be applied to Africa for reasons why we should help combat the disease. And the value of combating Ebola is necessary because people that are in West Africa that are working to combat the disease are not likely to contract the disease because of the strict protocol and precautions, and the death rate is so high that without the U.S. intervention, the people might die, or the people are going to die without U.S. intervention. And we, like my opponent has stated, have the most advanced medical care, and if we don't help, we're just letting them suffer. So I affirm the resolution that we need to help combat Ebola because of American hysteria, the death rates, and the low risks our soldiers have of contracting the disease.